All right, going to get started. I'd like to thank everyone for attending this session on program innovations during COVID-19. My name's Eric, and I'm the manager of corporate events and projects at Volunteer Canada. We've shared this session across the country, so interested to hear where people are listening to the session from. Please post it in the chat. We're eager to see. And one other housekeeping item, we'll be recording this session and sharing it out to everybody that's signed up today. Next slide, please. So a little bit about my organization, Volunteer Canada. Volunteer Canada provides national leadership and expertise on volunteerism. Since 1977, we've worked closely with volunteer centers, nonprofit and charitable organizations, business, government, and educational institutions in order to achieve our mission to provide leadership in strengthening citizen engagement and to serve as a catalyst for voluntary action. During the pandemic, we've been producing and collating a number of resources centering on topics from volunteer management and public health to sector advocacy and corporate community engagement. Next slide, please. I'd like to acknowledge our funders that help make the health sector spotlight sessions possible. It was made possible thanks to a contribution from Points of Light and the COVID-19 Response Fund grant from the Center for Disaster Philanthropy to support long-term recovery efforts of volunteerism in the health sector. Next slide, please. In a few minutes, I'll be turning it over to the presenter for this session, Ulyana Osorio. Ulyana is the coordinator of volunteer resources at the Ottawa Hospital, as well as the co-chair of the Ottawa Administrators of Volunteer Resources. She'll be discussing virtual innovations for some of the Ottawa Hospital's volunteer programs. Be sure to post any questions you have for Ulyana, as there'll be a Q&A following her presentation. Volunteer Canada is hosting this session as it's an especially turbulent time, and many organizations have needed to transition to virtual programs as the pandemic continues on. We've sought to highlight an organization that made a quick adjustment during this time and to offer potential ideas for your own organizations if it's something you think can fit for you. But first, I'd like to set the stage to show the scale of disruption that's occurred to organizations and their volunteers during the pandemic and highlight some of the shifts that are taking place. Volunteer Canada commissioned Ipsos to conduct research in order to understand the impacts of COVID-19 on volunteer organizations and volunteers. The full volunteering lens of COVID-19 survey can be found on the resources page of our website. Here are some of the major data points. Next slide, please. There have been plenty of disturbances to the sector since the pandemic's begun, especially to programs, services, activities, and events. 40% of the organizations that we surveyed were based in Ontario, but all regions were covered. 29% of respondents of organizations to the survey canceled all their programs, services, activities, or events, while 67% canceled some. 44% of organizations increased some of their programming, while 54% have not. The majority of organizations have continued their programming while switching to virtual at 66%. Next slide, please. This slide focuses on the changes to volunteer roles. 51% of organizations have transitioned some of their roles online. 40% have actually suspended all volunteer engagement until further notice. And a number of organizations have expanded roles available at their organization at 13%. Next slide, please. This graph shows that the majority of organizations plan to have a plan in place to re-engage their volunteers. Specifically, 18% already have that plan in place. Next slide, please. The following two slides are from the volunteer perspective. This graph focuses on what inspired volunteers to volunteer during COVID-19. The top one, 60%, showed that individuals wanted to support their community when others were not able to do so. The second one, a very common refrain, is to use their skills and experience. And the top third position is that they now have time available to volunteer, potentially related to pandemic effects, like not commuting. Next slide, please. This slide highlights reasons why individuals would have opted to volunteer or what has deterred them from volunteering. Access to and comfort with technology and availability were main reasons why someone opted to volunteer, while the deterred group is based around being an at-risk group or knowing someone who's an at-risk group member, or not knowing where they could volunteer. I found it notable that around 5% lost motivation to volunteer during this time. That's a snapshot of the sector, and as I said, many organizations have faced a turbulent time related to their programs and volunteers. My colleague Deb Pike has completed a fall survey to update the volunteering lens of COVID-19. There will be a webinar on November 21st sharing those findings. Be sure to check in. Now over to Ulyana to discuss the virtual program innovations that she has implemented at her organization, including the virtual information desk, virtual pet therapy and music performance visits, and the virtual student co-op program. Ulyana, over to you.
Thank you, Eric. Thank you so much for having me. I'm really honored to do this presentation for Volunteer Canada, as Volunteer Canada website is always the page to go to. That's where I always check resources, best practices, and just big kudos to you guys, because during this pandemic, this was a website where I went and my colleagues to look for any updates on the COVID, and we used your templates for Volunteer Week in March when we celebrated. So a really pleasure to be and speak on this webinar. So a little bit about me. As Eric mentioned, I previously worked at Volunteer Ottawa, and I led and implemented community engagement program, and also managed National Diversity on Board program. I am a board chair of local OAVR, so any of you from Ottawa, please join. A great organization for volunteer resource professionals, and a great opportunity for professional development. And I've been really fortunate for the last 4 years to work at the Ottawa Hospital. And in March, when pandemic closed, volunteer resources departments and most volunteers went home, some of my colleagues were redeployed. I ended up working from home. So for approximately 2-3 weeks, I joined a lot of webinars, and I was trying to read myself and learn what is out there, what kind of programs can we do, how could we still provide services, but in a very different way. But unfortunately, all I found is a lot of information about generally how important it is to have virtual program, but nothing really concrete in terms of services providing. So there was a lot of roles that do fundraising or documents, research from home, where most of our programs are really person to person. So we have to have somebody to interact. So that's really what inspired me to be brave and to innovate and create something that maybe is not out there. And you can see on this slide some of the pictures of some of our programs that are running right now at the Ottawa Hospital. And then I want to go during this webinar a little bit more in depth and explain each of them. And I hope some of them will inspire you to create, innovate, tweak, and then bring them to your organization. So we'll go to next slide, please. So a little bit about Ottawa. We are the biggest hospital in a city. We have multiple campuses, and our volunteer resource department includes a manager. We have 3 coordinators, including me, and we each run a different campus. And then we have 2 assistants. And we have we have around over 1,400 volunteers. And out of 1,400 volunteers, we maybe have 2 or 3 roles that are remote, where people working on different projects remotely. So this is before March 13. And in terms of programs, we have programs like in many hospitals across Ontario, where we have emergency department volunteers, ICU, inpatient programs. We also include spiritual care and auxiliaries in our programs. So this is a little bit about us. And on March 13, when we have mass lockdowns, 4 of my colleagues got redeployed, and me and my other colleague, Suzanne Larivière, we stayed back in Volunteer Resource Department just to wrap things up and kind of on a standby waiting where we will be redeployed. And that kind of gave us a little bit of time, communicating with volunteers and then just being in a unique position, not knowing what's happening next. Next slide, please. So what's been happening during this 2 weeks, we got to contact many volunteers, telling them what's happening, that for now we don't have any volunteers on site, and we're just waiting for, for the news and kind of following different public health authorities' advice. And during this time, we got a lot of notes, a lot of messages, a lot of phone calls from young people who were our co-ops. So we normally have approximately 20 co-op students between all 3 campuses. And as you can imagine, they had the most time because school was suspended. So they were at home looking how they can contribute. And many of them were in their last chance to actually do co-ops. So they were grade 12s. So they really enjoyed their few weeks that they were able to go in person in a hospital, and they really were reaching out and asking, is there anything we can do? So then, we were really kind of having ideas, thinking, talking to them. And then next slide, please. So this is how a virtual co-op program came to life. So as I said, many co-op students reached out to us. We were really, at that point, couldn't really tell them anything concrete. We were like everybody else, just waiting what's coming from any other resource. But being a teaching hospital really pushed us a little bit further. And then we had this idea at some point, maybe we can just invite guest speakers who can have, live meeting and then tell a little bit about their jobs. So I shared that idea with my colleague, Suzanne, and then we'll start developing it. So we met with teachers, and when I mentioned 2 teachers, Michelle O'Sullivan and Winka Cooper, who were really instrumental when we met with them, and we said, listen, we have an idea. We want to put a virtual meeting where we will have guests coming from the hospitals and just telling what they do, in their jobs, and that way students could learn. And they were really inspired. They said, this means so much. And they said, students are really scared. Schools are shuts. So if you can put something like this, we will talk to students, and we almost guarantee they will be more than happy to join your program. So we had a lot of buy-in and really work with teachers to come up with a format a little bit. We also have internal opportunity and possibility just to do it ourselves. Very often when you have idea to do something, there's so many other stakeholders who are involved. In this case, our co-op program is just with Volunteer Resource Department. It's run by coordinators, so we didn't really need to consult, our director or anybody like that. We had resources to do it ourselves. So that was also a timeline. It was quick for us to implement. And it took us, as you can see, timeline, it was 2 weeks from the moment that it was just an idea. We started talking and we all said, let's do this. So that's how everything came to life. And we didn't really spend much, in terms of money. That was just our regular working hours that we will meet with students and start one of those first co-op programs. So next slide, please. So as you can see here, the way we formatted program, that every week they will have, students will have assignment. So they will do medical dictionary. So they would, at the beginning, they research those words as a vaccine and COVID and all the respiratory, terms. As you can think, it was still March. Then they will have weekly meetings with a guest speaker. And that was something that we were not sure if we can get. We were aiming to get a healthcare professional during pandemic where a lot of people were deployed, and those ones who on site really overwhelmed. So there was a really different vibe happening in the hospitals. But Suzanne and I just took a leap of faith, and we said, you know, we will start with us. So one of our first speaker was actually a volunteer who was hired at the Ottawa Hospital to be a screener. And then I got in touch with him and I said, listen, would you like to talk to students and just to tell them what you do? And he said, sure, I would love to. So he was able to tell what he does as a screener. And it was, you know, first time they ever heard about screener, and they learned what they do and what kind of procedures they, you know, they have to follow. And they were asking a lot of questions. Are you scared to be there? Things like that. Now we know so much more about the virus. But this is how we got with the guest speakers, and we were very surprised that we reached out to emergency department staff, to you know, like occupational therapists, dietitians, stroke team, and we never had no. We found the staff was very eager to share with students. They always found the time, and it almost, they had a pride to share of what they do. So we were really lucky. We were a little bit worried that maybe, you know, staff will be too busy. They're literally fighting pandemic. But we were really lucky in that sense that we've never had anybody saying no when we approached them to be a guest speaker. And one of the other assignment, there was a group project. So we wanted students to do something together. So they came up with amazing thank you card collages. They've created a lot of like gratitude messages from a community. And when I came on site a couple months later, I think in May or June, I went into one of our campuses, and we normally send everything to our communication department that students would create, and they put these beautiful posters. So when I walked in, I saw some of the posters on the wall, and it was really fascinating. I never expected to see that. So it was really nice how those messages that students who participated in our program were actually on the walls and staff could see. So they did amazing work for Nursing Week, for example. So we would really follow up what's happening in the hospital. So this will be a type of a group project. So this is overall the structure and some of the highlights. So currently we run this program now third time. We're right now in the third time. And in November, we're starting at our fourth run of the program, and we already have 20 students registered for that. We had 40 students so far who took part of it, and this also became our recruitment strategy. Right now we don't recruit any volunteers because we don't really know what roles we will reopen and how things will look like, but young people who just, you know, starting university, finishing high schools, they all want to help. So when we're ready to restart, they could be that pool that we reach out to, and those will be some of those volunteers who also can help us, you know, in our virtual programs if we have a need. So this is a little bit of building capacity for the future for us as well. This gave us opportunity to interact internally. We're a big organization, as you saw. We close to 12,000 people who work for the Ottawa Hospital, and we have so many departments and units. So it's really gave us opportunity to work with different organizations, with different units. And for example, occupational therapy, we never had a program. So that gave you opportunity to get to know and to listen what they do there, and see how the volunteer can fit in there. And if you're in a smaller organization, I would say you can maybe reach to stakeholders outside of your organization and build relationship that way. So this became really kind of win-win for us. And this September to November, we're collaborating right now with the Royal Hospital. So we run this program as collaboration between two hospitals, and students have to listen. They got opportunity to listen to both speakers from the Ottawa Hospital and from the Royal. So it really, the program is still evolving. We're always tweaking it and growing it. And we're hoping to continue it in the future. Will be a hybrid between in-person and online kind of concept. Next slide, please. So Virtual Information Desk is one of the really unique program, and idea behind this program came first from really need for information when patients start coming back, and second also from volunteers who were really looking into start volunteering again. I've sat on a meeting, I believe, is where somebody said, you know, now we have patients coming back for in-person meetings, and nobody really know where to point it at them, because screeners, who usually the first point of reference when they come and meet them, they are redeploy staff from all over, from different campuses that don't necessarily know locations and where ICU is and where is dialysis unit. And that same day I spoke with a volunteer who was saying, you know, I really miss being in a hospital, but I don't think I can come because I have health concern myself, so I will really wait until we have vaccine, but I would really love to help from home somehow. So they just sparked an idea, and I thought, you know, I have a volunteer who's really knowledgeable, who knows all the locations, and then I have a need right now with people and even a new staff who were deployed coming to different campuses, and they need that information. So I just need to put two together. So I thought, why don't do just meeting like you and me? We join, and then volunteer can tell you where to go. So that's how the concept came into. And as you see on the first slide, there was a problem that we know there was a really need, and our information desks were empty. And then, you know, I had an idea and I figured out, okay, I'll just Google it and I'll definitely find something to work with. And when I Googled very quickly, I realized the concept itself does not exist. The virtual information desk does not exist, and then volunteer virtual information desk just does not exist, at least in a Google and a couple other engines that I tried. And now actually when you Google, you'll see Ottawa Hospital comes up, and then the picture that you see Suzanne and me lunch, which is really funny. When I was preparing this presentation, I was wondering what happened now if I Google if something new comes up, and then I saw myself. But this is really kind of where it gets scary a little bit, because I had this idea, I had the concept, but it was really tricky, and the hardest part of everything, it was just to explain to other people what I really mean. And you know, you see that first picture of a volunteer sitting on a screen, and it took us 3 hours for me to explain to her how I wanted her picture to be in a screen, in a computer. And then she took a picture of herself looking on the computer. So just the concept. So it's really important when you have an idea to develop your pitch and to get the buy-in. And buy-in maybe from few people at the beginning. I shared that with my colleague Suzanne, and she was on board right away. So we slowly started developing it together. So we reached out to IT just to see if it's possible, because I knew it was physically possible. I could just put my computer, my laptop, or we actually do have computers at the information desk that we can turn and connect volunteers this way. But actually running it for a long period of time, we run right now information desk from 7:30 to 3:30. So all those nuances, we really need a little bit of experts to help us. So we engage a lot of shareholders, and I'm going to touch on that in the next slides. And then when our leadership team, you know, when we presented to them, we presented a lot of different programs that we can do virtually. They said information desk was actually urgent and we have to do it now. So they saw the most, like, you know, value in it, and information were needed now because patients were coming to the hospital more and more. So we had 2 weeks from idea to when we actually took this picture that you see me and Susanna. That's our training sessions with volunteer. And it's really important for us to stay with zero budget. So we did not have any money to develop that. So pretty much just our own resources. And then next slide, please. This is some of the shareholders that we had to engage in order to implement this program. Previous one was very easy. It's just, we can do it on our own. But here we really needed IT department. It took them 4 weeks, to talk to them, to develop everything behind this. IPAC, of course, the way it's designed, you don't really need to touch anything. It's, we really want to make sure there's no buttons that people can touch. So it's started remotely, it's troubleshoots remotely. So everything is done really without any, there's no need to be somebody on the site to launch it. A privacy officer, we want to originally record interactions just for, record or any safety concerns, but we were advised against it, so nothing is ever recorded. Accessibility, we were looking about having closed captions, so we will be implementing it in the next few months. And of course, security, just to keep an eye because it is just a computer, right? Next slide, please. This is how the program is designed. It was extremely important for us to make it sufficient. And as we learn a little bit more about managing volunteers, so as you see, we have volunteer coordinators and assistants who oversee the program. Then we have a volunteer program team lead. And then we have somebody who is responsible for onboarding and training new volunteers. We have somebody who helps us with reporting and data. And somebody who helps us with shift replacement. And then each day, Monday to Friday, we have a team lead, and they have under them 4 volunteers. So our shifts are 2 hours. So we start at 7:30, then it will be till 9:30, and then it's go on. And we have 4 volunteers who spend each 2 hours at the information desk. And then we have a backup volunteers, those one who train, maybe cannot have a regular shift, but can step in and help wherever we need. So this is a little bit of a design that, that we created. Next slide, please. And this is how we function. Volunteer just logs in, they put their volunteer vest, their ID badge, they open their binder. So they look into, it's all digital on their computers. They look for any updates. We update them regularly. Then during their shift, they interact with other staff like screeners, porters, so they have all the information to connect with them. During their shift, they provide information, and we also have a capacity to log in and check on them. So if somebody needs me, I just on my phone get alert, and I live can log just like you and me in this webinar. We can log in and just oversee or talk to volunteer. So we're using Microsoft Teams. I'm not sure if I mentioned that. So we're using Microsoft Teams in order to run this program. But I believe it could be done with any other technology like Zoom or Google Meetings, etc. After their shift, volunteer record the amount of patients that they helped and some other information we need. And then they have their own groups that they check with team leads regularly. And then every 2 weeks, we meet as a bigger group with any updates and just a social element of it. So this is a bit of how it works. And then next slide, please. This is a video that I took one of our volunteers, and this is actually not a patient. It's my administrative assistant, but due to privacy, I didn't want to have actually a patient on. And this just shows you how it actually works in reality. So I'll just let you hear the video.
Yeah, so you get to MRI, you're going to go down the long corridor on your right-hand side. So, and then this way. Yeah, just go wide corridor. Yeah, so just keep going. You'll go up a little ramp, and then on your left-hand side, you'll see the C elevators, and you take them up to the first floor. Okay, thank you so much. Have a great day. You too.
All right, so this is a little video just to give you a live experience what virtual information desk looks like. And as I said, it's very efficient. Volunteers love it. Patients find it very interesting. And this is a little bit of impact. So we currently have it only on 2 campuses, one of their biggest one. We have approximately 60 volunteers engaged in the program. And this is data just from the last 4 months. We have volunteers put into almost 2,000 hours. You see 100, 800, and we almost 600 patients have been helped. So this is just to give you a little bit of impact and some numbers. We also shared this idea a couple months ago with our internal network in Ontario with over 45 hospitals, and now we have 2 or 3 currently who reached out to us, and they're either ready to implement or implementing in the next few weeks, just tweaked it a little bit to their needs. So we now are creating a community in Ontario of the hospitals who just following the footsteps of Ottawa Hospital and using this tool to help them, especially as we're in a second wave of COVID and we want to reduce number of people coming through. And there's also an article in the Ottawa Hospital Journal about this program and from volunteer perspective a little bit. So if you're interested, you can check the link a bit later. So this is a little bit about information desk. Next slide, please. Some of the notes that I have here, return on investment. So it was really important for us to eliminate the risk and transmission. When volunteers coming to the hospital, there's always that chance for risk, and we have a lot of volunteers who, elderly, who've been there for a long time. So we didn't really want to take that. So having this virtually really reduced that to 0. We also don't need to spend money on PPEs. I know some of the organizations bring volunteers back, so they need to provide PPEs, and we eliminated that cost, as well as the parking. Our volunteers usually get free vouchers, so that opens up spaces for patients and also saves hospital a little bit. And also the most important one was to engage volunteers who are at home, and we didn't really know for how long it will be. So so that was important that they start helping right now in those alternative ways, still serving patients before they're allowed to come back in person. Next slide, please. So next program is virtual pet therapy and music performance. So this is a pilot that we run in 2 areas. One is in our hemodialysis unit and also in our inpatient unit. Next slide, please. This is, again, very straightforward. Volunteer from home connects to Microsoft Teams meeting, very similar that you join right now to this webinar. And then we have in a hospital, we have either a clerk or nurse or social worker, depends on the area. They connect as well. And then they have this long IV pulse, as you probably noticed at the beginning in one of the slides, that they just bring to different patients. So patients are usually pre-selected. Staff knows their patients who would the most benefit from the interactions, and then they spend between 10 to 20 minutes, depends on the patient, with a volunteer, and volunteer usually introduce themselves, tell a little bit about the dog, or if they play music, they will tell a little bit what kind of music they like, and then they have interaction. It's really nice that it's not as like loud, and it's a little bit more private. So patients, if there are other patients don't like music, they don't need to listen to that. They can just, rest while they're getting treatment. So it's really personalized. And I was a bit skeptical if it will work at the beginning, but when I've seen it live, I was really touched to tears, and how patients right away knew that there's a dog, and they start asking questions about it. And when they hear music, they will start commenting how beautiful and like applauding to volunteer. So it's quite a successful 2 programs that we're piloting right now. And next slide, please. And this is actually a live video that you'll get a bit of a sense. So I'll just let it play.
Oh, what a good boy. This is amazing. Hi, Caleb.
Oh, that's a nice picture of you too, Christine.
So this is our virtual pet therapy handler and Caleb, our famous dog. And then we have another one with our music therapy. So this is just a little bit of a sample to see live. That's what patients see. So they, of course, have a bit of interactions at the beginning, and that's how it looks like. And then our next program is our Human Resources Support Volunteer Project. So this is our beautiful 2 volunteers who started program as we were talking a little bit with our manager of screeners. So hospital right now really are hiring a lot of screeners, and we had a high need when we started taking staff who were redeployed back to their regular jobs, and then there was a void where we really need to hire a lot of screeners quickly and just get them into the workforce as soon as possible. So these 2 volunteers, they are volunteers with us, but they also been hired as a screeners and work now for the Ottawa Hospital. So we had an idea that it will be really important as the new people are onboarded, they have somebody who can kind of follow them through the process. We have very complicated process for recruitment. Usually it takes, a couple of weeks from the time you're hired till the time you start. People need to take all kinds of, TB tests, police records, all of that, and usually different departments who engage in that. So by having a volunteer, it really creates somebody who start right now a job in a hospital during the pandemic on a front line. It could be a little bit, unsettling. So by having a volunteer and also somebody who knows the job, it's really win-win. They kind of guide them through the process. They say, oh, did you get the email from this department? Oh, next step, you will be, you will be waiting for this person to contact you. And they just kind of guide them through, so people don't just wait at home and wonder what will be happening next, or if they have a question, they have somebody they can contact. So volunteers created so they reach out to those screeners, they do one-on-one sessions, and they do group interview sessions. And then staff gets helped with a new hire reference call. So sometimes if, there's many people we recruit and the references need to be checked, volunteers have expertise in those, they quickly do that. And then they do support, as I mentioned before, this onboarding new staff as well for screening. And then new hires, and this case, it's not patients who benefit, but new hires, they get the benefits of having a volunteer that they could contact and ask questions and, talk on the phone, and not just, like the overwhelm the staff that already kind of stretched. So this has been very successful, and it's a little bit reach out away from patients and helping staff. So we really try to be creative in the roles, and we're really looking where the need is. So that we saw the need, and then we just put those 2 programs together. Next slide, please. Remote courtesy call is a unique program that, itself came up, as you probably can imagine, with, patients returning to the hospital and all the screening happening. All of a sudden, clerks and nurses start doing those phone calls and asking screening questions to the patient. So that takes a lot of time from them actually being with the patient. So the courtesy call program was created. We piloted it in 2 clinics, our ENT clinic, and then a medical daycare clinic. And now we are starting tomorrow, we're launching it in family health clinic, and then we're also launching it in a couple of weeks in a dental clinic. This will be our fastest growing program, I anticipate, because it's really neat across any kind of clinics or where patients coming in. So what we do, we usually call and ask screening questions. As you see here, usually volunteers will make between 15 and 25. Sometimes it even can go to 35 patients. They will ask them COVID screening questions. So that prevents the problem that when people come and they have symptoms and they fail the screening questions, screeners will turn them away. But if we call them ahead a day before and we ask the question and we know they will not pass the screening questions, then we can ask clinic staff to follow up and either reschedule their appointment, or if it's essential treatment they need to get, then staff will be prepared to meet them and use appropriate protocols to assist them. So they ask screening questions, and then based on them on a campus, they, advise, they tell them about our mask policy, they tell them about the parking, they tell them about anything else that they need to know about visitor policy. So hospital look very different now that it was 8 months ago. And many people, when they come, they really don't know what to expect. So they have a lot of questions. And volunteers have time, so they can spend, some people just like to socialize and they don't get to talk to many people. So it's a longer phone call. Other people are busy, they just happy they got information. But that's been really rewarding for volunteers and for the patients. So staff, they create the list that patients needs to be called, and then they have it through a secure site, and then volunteer access that and then report back into it. And we came up with a really unique, we were really considering patient privacy. So we came up with a concept that volunteers don't collect any information, they just color code it. So they put green, yellow, or red. And green is good to go, staff doesn't need to follow up, and then yellow and red, staff needs to follow up. Because there may be something that they came up through the phone call. And then there's an opportunity to make a note. So that way, patient benefit from getting a call before their appointment, as I mentioned, so they don't come and, and surprised by something like, let's say, mask policy. Many patients come and say, oh, I don't have a mask, can I come? And they run to their car, or they don't have in their car, and then they worry. And that way they know, because volunteers say, don't worry, if you don't have a mask, we will provide you one. So they really kind of explain this new environment and new policies and rules. And then patients always ask some questions that, and the volunteers also tell them that they don't, respond to any medical questions right from off the bat. They have a script that they read. So as I said, this is like one of those programs that we anticipate to implement in more and more clinics, and extremely successful as well. And some of the impacts, so this program we run for approximately 2 months now, and some of the clinics, as you see, and we have 15 volunteers right now who contributed over 300 hours and almost 2,000 patients that they've called. And it's almost October, so this will be even bigger. We usually at the end of the month add some numbers. So this is a slide that I created just to show you a little bit of timeline and how we, started our programs. And you can see in March we start with our virtual co-op program, and then in June we started with another virtual co-op program, another semester, and then in July we launched information desk, and then in July we also launched our courtesy calls almost at the end of the month. Then in August, we launched a project, which is a big database that we're creating. So we have a group of volunteers, and my colleague Suzanne working on this project with multiple stakeholders. So this is more of the project than the program, but it's also very innovative just to modernize the way we get information. In the hospital, we also have pet therapy, and we had a project in September of our volunteers. We are teaching hospital, so we have students coming to the hospital in their first year of medical school and learning how to interview patients, just to ask them a little bit about what's going on. So now with restrictions, they were not able to do it, and we were working together with manager in the social work department, and we recruited a group of volunteers who were doing it remotely. They will meet with the students in their classroom, and they will pretend to be a patient, and they will talk about their, let's say, ankle or their back pain and things like this. And they really interact a lot with different patients, and they've been patients themselves. So it was really win-win, and it was only for months, I believe September and October. So that was a really nice project. Right now we're collecting a bit of a data, and we will have a meeting just to review how it went. But volunteers loved it. It was big saving for the medical students, because they got to talk to some people. So it was really win-win, and programs like that, and projects like that just come from talking to people and see where they need. So we really kind of need to adjust in our in the way we deliver services and volunteer resources. And then, of course, just to go back to October, again, virtual co-op. And this semester, we're collaborating with another hospital, Royal. So we run it together, as I mentioned before. And in November, we're hoping to launch another co-op program. And one of the programs we were thinking is Essential Caregiver Pilot that we will be launching in our rehabilitation center. It's where caregivers could come and support even during visit restriction policy, support some of the patients. So we're trying to see how volunteers can help with making this process a little bit easier. Next slide, please. So some of the lessons learned from all of this, number one is that most volunteers are open to learn new technology. And I've read in one of the survey that they said that when you start a new program, you will lose approximately 34% of your volunteers, so that they will not be able to participate. That was not the case for us. We maybe lost 3-4 volunteers that they could not really, use technology. But other than that, we have volunteers in their 70s and 80s who are using SharePoint, Microsoft Teams, and we developed really robust teaching system where volunteers teach volunteers. And it's so really, we were really amazed how naturally everybody just started doing it. Innovation requests, your pitch. So I mentioned that before. If you have an idea, very important to share your ideas and really put them on the slides. As you see, I put this PowerPoint presentation. Anytime I have an idea, I don't tell anybody. I just put it in a PowerPoint or a Sway or anything else so people can see it visually, and then it speaks for yourself. I would encourage you, sometimes if you have an idea, go for it. But definitely get some buy-in and support from people before you start. Technology has its limits, so we have robust processes what to do when technology fails. If you lose power, if somebody loses internet connection. And information desk, for example, we have a volunteer who live, but if he for some reason loses power at home, we have another one who can just jump in, and it takes literally under 1 minute. So we really have this built in and kind of like a lots of backup plans, what we do when technology fails. We anticipate to use virtual and remote programs and create maybe a whole area for that. So we will go with many programs and create hybrid. So we will have always virtual information desk, but then we'll have info guides when we're allowed to come back, and it's safe for our volunteers. So we will always use technology. We often have snowstorms here in Ottawa, and people cannot just get to their volunteer role. So now with virtual information desk, we can just tell them, you know what, just join virtually. Today it's really not a good day to commute or take bus. We don't want you to slip. In the evening, sometimes it's much slower, so we don't have somebody to come back. So we really try to use that in the future. And the virtual program focus more on outcomes and less on managing people. So working in those remote programs, we really start focusing what we wanted to achieve. And then we looked at our numbers and less on kind of, like, did this volunteer do this and did the volunteer do that? So we're really changing kind of the way we look at our programs. And for information desk, volunteers are so passionate. They helped us to develop it. They feel ownership over it. And it's a very different engagement when volunteers just come in and start program. We don't have issues with, attendance, nothing like this, because they know if they're not there, there's no service. So the outcomes are absolutely outstanding from so far that we've seen in the last 8 months. Next slide, please. So I just want to thank you, Suzanne, who is my colleague, and two of us been, from the moment in March where we kind of want to stand by waiting where we're going to be redeployed. Because of all this program, end up staying all the time in volunteer resources and have an opportunity to develop and implement these amazing programs. I also want to thank you, our leadership team, which is like our manager, Sherry Daly, Laura McDonald, our director, and Renee, our VP and IT team, who've been extraordinary. some stakeholders like teachers, colleagues from other hospital, and the Ottawa Hospital volunteers. They really took a leap of faith and were eager to try this with us. So without them and their abilities and desire to help, none of that will be possible. So that's it for me. This is my email address. If you have any questions, please reach out. I'm happy to help. And if you have any questions, maybe Eric, you can pick some of the questions. I'm happy to answer.
Yeah, great. Thank you. Thank you very much, Ulyana. So if you open up your Zoom, you'll see the Q&A, and I'll start reading them aloud to the group. But I wanted to start with one on the budget. So for a few of the slides, you mentioned that there was zero budget spent. So how'd you get the equipment? How are you able to use it? And for those with, say, a modest budget, is there a way that they can start their own programs?
Yeah, so I remember where we were talking, the budget question, actually, I put it in this slide because it's asked very often when I talk about our programs. We've been told that everybody loves our program, but we literally have no money to give you. So we had to be really creative. So of course it was time that we put in developing it. In terms of equipment for information desk, we had TVs that already IT department had cameras, microphones, so they just had it in a stock, so they didn't really need to purchase. But I can see in a smaller organization, we actually had a computer at the information desk that we could have used it. So we had them to have somebody to push the button to plug computer. We'll just adapt, but you can use it with laptop. You can just put your laptop wherever you have. This program could be implemented in your reception area, and you can just use any technology you used in the past. So it could be really simplified. It doesn't have to be like you use what you have. So in terms of technology, as I said, laptop will work perfectly. Everybody has a laptop. They just can use this. And then in terms of it's a lot of time. So when we talk to IT team, they're developing so many other resources. So we had really buy-in from our leadership team, and they said, no, make it happen now. So they've been giving priority that they could help. But also if you have a volunteer who really, high tech can help, they can help you to connect. They can teach you. It doesn't have to be Microsoft Teams. It could be Zoom. It could be any system. You create meeting, and then you just keep that meeting for whole day, and then you just do it recurring. So you can really engage what resources you have. So none of this program really need a big resources, and it's a smaller organization. You can use what you have. So use volunteers if you don't have IT department who know how to use technology. Use wherever you have laptops for just implementing it, and just pilot it. So from pilot, your leadership and executives will see it works, and then they might invest a little bit in to make it, maybe better looking.
Thanks. A question on the virtual information desk. For more difficult questions, is there a way that they can troubleshoot them, or is there a kind of a set of answers that they know to answer to? What's the breakdown of that?
Yes, so at information desk, we have volunteers who really experienced, who've been on that desk for 10, 15 years. So they're really expert. They know all the questions, how to troubleshoot. If they have, let's say, sometimes they see, we had situations when somebody fainted, and volunteers see it because they physically can see a lobby and nobody right now passing. So volunteer has a number that they can call and alert somebody in a hospital. But usually we're really on the busy campuses. If they notice that somebody sitting in wheelchair and waiting long time for the porter, they can really reach out. We have binder that they can reach out remotely. So we put all the updates in there. Some of the entrances, for example, close, and some of the places we need to go, we have to go through the basement. So volunteers do have the most updated information, and they have place they can access. So some of them know it just from being there for experience, but there once in a while question they will get asked, how to get to the records, or some of those areas that maybe not very common, so they know how to access on the binder. So they have virtually, it looks like Excel sheet, but it's a it's a binder, and we developing database that will be really easy, and they can show maps for the patients in the future, things like that. So we're really kind of working on modernizing it and taking it to the next level.
Another tactical question with regard to the information desk. So does the volunteer sit with their screen open for the entire shift, or do they get contacted as needed?
Yes, so they have a live stream. So they sit, and if it's like really quiet, they just see the lobby, so they see what's happening. So normally at the information desk, they will also sit. If people don't come to them, they just sit and maybe chat between themselves, always staff. We have the same concept. Porters come, other staff, they come and they talk to them because they know people, and they get creative. Right now we have a bit of slow down time from 3 to 4, so I can see some of the volunteers put the sign Happy Friday or something like this, so they really try to engage. So information desk, it's a busy place. People always come to say hi. You will see people coming by and waving. So it's very interactive. There's never a dull moment, and staff tells us like how cool it is and how interactive, and they always and sometimes you see somebody walking and the volunteers start waving and they have to stop and move. So they really try to just be part of it as they always were. Information desk always in the hospital being a big part, and they created a community. They get to know people. So they see the same faces. And somebody told me the other day, there was a staff member walking, talking to a volunteer, and then he was saying, "I'm gonna get a coffee. Do you want one?" And then they both laugh. So they just, kind of engaged in the same way. So when it's really downtime, they might have a book and look at it, but normally they will just sit and try to create a little bit of interactions if it's really quiet.
Great. A few questions are related to privacy concerns around courtesy calls, specifically with volunteers having patient information. What steps have you guys taken to protect patient information?
So we're using a SharePoint site, and our volunteers have internal emails, and the way they see information, they cannot download, they cannot print it. So we actually consult with privacy officer. So that's why, clerk puts it for that hour, volunteers make a call, they report, and that information is taken out. So there is no really a way for them to share or distribute. So that's very well thought through. And all of the volunteers, sign confidentiality. We screen for that program quite often. We also have volunteers who are on the site. They always will see patients, so they have exactly the same access that they would have before. We had roles where volunteers will have a patient list and just welcome them into units and helping them and explaining the process. So in that sense, we really have developed very robust protocol and safeguards.
Nice. A question on the HR support volunteers. Do they need any, do you guys do any special recruitment or training for those volunteers?
So we're really lucky. We're a big organization. So some of volunteers do have HR background, or they retired government. We live in Ottawa, so retired government employees. Some of them we provide training. So for reference check, we have both. We have some that we train and some they have experience from their previous jobs at the paid staff. And for the supporting screeners through the process, we picked 2 volunteers who are also screeners, so then that they understand because they've done the onboarding themselves. So there's really we do have unique either training or screening for those roles.
Perfect. Well, that's all the time we've got. I want to thank Ulyana again for participating in this session. We hope everyone found this useful. We will be sharing out the recording of this session as well as the slides post-event. So if you joined late or you want some additional resources to share with your colleagues at your organization, you'll have both of those. They'll probably be going out later in the week. But in closing, Ulyana, just want to thank you again, and your contact information is on the screen. Any final words?
Thank you for having me, and be innovative. Don't be discouraged. Just innovate. Thank you.
Thank you.